Hello, I am Kiran Modi from India. I run Udayan Care. It's an organization for children without parental care. So we have been practitioners for the last 25 years and we have been working with children and youth, and that's what interested us into researching care leaving in India. Here, we have the study that we did, beyond 18, leaving childcare institutions, and how can we support youth leaving care. These are our research objectives: to establish a relationship between life in children's homes and the challenges faced by care leavers as young adults. We also wanted to understand the nature of challenges they face. We wanted to grasp and document emerging and promising aftercare practices in India. The fourth objective was to ascertain the average number of adolescents who exit CCIs and after completing of 18 years of age. And the fifth objective was to recommend measures so that governments of different states in India can adopt them and make better practices available to care leavers. Our methodology: we did an exhaustive literature review. We developed our own questionnaire and interview guides, operational definitions. We designed a team training, and the teams were trained into administering the questionnaire. Ethical protocols were maintained. Thematic framework: we developed a beautiful thematic framework which is called Sphere of Aftercare, about which I will tell you in a minute from now. We also used Mike Stein's resilience framework to understand the youth. Where are they going? Then, of course, data analysis, interpretation, indexing. We also wrote the limitations that the study faced. We had several roundtable consultations with different kinds of stakeholders, whether they were government functionaries or they were youth. And we did the sample collection. After that, the questionnaires were finalized and we conducted study, based on that. We covered 5 states of India: Delhi, Gujarat, Karnataka, Maharashtra and Rajasthan. 100 plus were key informants, the functionaries. 100 people were interviewed, and we also met 435 care leavers. We developed 25 case studies. If you look at the care leavers demographics, we had almost equal distribution. 55% were boy care leavers and 45% were female care leavers. We looked at, because in India, there is a lot of work being done by NGOs. So we looked at 48% government-run children's homes and 52% NGO-run children's homes. We also looked at 27% youth who never received any aftercare, and we looked at 73% of youth who received aftercare. And that in itself, proved that even when they are getting aftercare, they are not getting much support. We also distributed by age. So in this study, 27% youth are 22 years and above, and the rest, 72%, are 17 years old and 18 to 21 years old. This is the thematic framework. If you look at this thematic framework, we looked at these 8 domains on which the children should be assessed and children should be supported: identity and legal awareness, housing, independent living skills, social support and interpersonal skills, emotional well-being, physical health, education and vocational skills, financial independence, and career guidance. So these are the 8 domains of our sphere of aftercare. And we found everywhere it was so lacking. If you look at housing, half of the care leavers, they could not get any access to housing support, even though you've seen how many were receivers of caregiving. Then independent living skills, many, 30% felt that they were not given any kind of support. Social support and interpersonal skills, more than a quarter were unable to get any kind of a support even on this. In emotional well-being, 61% faced recurring emotional distress. 78% care leavers did not have health insurance. 40% children or youth could not complete schooling by the age of 18, and the dropout rates increased from 20% to 34% during transition. If you look at financial independence and career, 48% had no independent source of earning. Average monthly salary, when they begin with, it's just about 7,500 rupees. $1 is equivalent to about 50 rupees. After this has been a seminal study, and actually, no such study had been done in our part of the world. And based on this, we could develop a series of recommendations for the governments to look after. So we suggested that there should be a national policy on alternative care. There should be effective implementation, because sometimes the laws are very strong, but the implementation is very poor. We also suggested changes in the policy and legislative framework. And we also suggested that there should be linkages and convergence between different ministries so that care leavers could be supported. There should be better training programs while they are children in the children's homes, and when they migrate to aftercare, there should be more training programs for them as well as the functionaries, and there should be more evidence generation, which is not happening so much in our part of the world. So research should be a very, very important aspect of it. And the last recommendation, but not the least, was collectivizing the care leavers. And since then, I'm very proud to say that many governments have, taken cognizance of this study. Many new laws and policies are getting framed, and many care leavers associations have also sprung up. Thank you.